Hey docs, good afternoon. Good afternoon. Welcome to week number 2 of July 15th. How time flies. I hope you guys are enjoying yourselves and studying hard. I do know that I would really wish I implemented what I'm teaching you all when I used to study. Because back then it was a different day, different time, different game. This test is evolving, and because it's pass or fail, many people underestimate it. And I'm always, whether I'm talking to medical schools, universities, program directors of university programs like hospitals, residencies versus clinical coordinators in schools, many of people are complaining because people are failing step, and because of that, they have issues with step 2 and so on. So this is the time now where we push hard to make sure that we're not trying to compress the 2 years of medical school that we had. We're trying to get the points to pass. I know it's easy. I've said this over and over again, but I find myself repeating this very often, whether I'm on the phone, conference calls with university programs and or schools versus students, because we're taught and we're pushed to study. Problem though is some stuff we just don't get, and then we go to videos, and videos don't help either. So I'm happy you got girls here today. I'm happy you girls are here today from the West Coast, and looking forward to doing endocrinology today. Typically, originally in the past, I used to have one sessions in previous companies that I launched and created, but I did realize that there was so much information to do that 1 hour is not enough. So that's why I decided to do 2 hours a day, one morning, one afternoon, instead of back-to-back hours. Because hey, I wouldn't want to be on the computer every day, all day, whether I was a student and or teaching, because it's exhausting, right? So, but at the same time, I hope that everything we're doing so far is helping you doctors out here. And please, we're going to be set up times where I'll see you guys individually throughout the week to make sure you're doing well, because I know getting on here can be exhausting, can frustrating, tiring. Sometimes you can't physically jump on, so you participate via text, via chatting. Other times we can jump on and do questions live. So, if either way, the more you can communicate with me, let me know what obstacles you have, what issues you're having when you're studying, the more I can help you and guide you. These sessions are created for one main purpose, to create better test takers of you all. At the same time, I work very hard to help you with the basic sciences, to help you remember certain conditions, diseases, to improve your study habits and skills, to not only retain the information, but not so much memory, right? So not so much memorization, just more of logic and more of just building that foundation of medicine, right? So we're doing endocrinology today. We're going to focus on thyroid, maybe a little high thyroid, low thyroid, maybe a little diabetes mellitus versus insipidus, maybe some medications. Again, endo is pretty big and pretty enormous when it comes to studying for it. Just as you know, it's challenging. It's very, very how do I put it? It's important. Like any other topic, any other system that we have. So let me ask you girls here, what issues do you see with endocrinology that happens to you when you study? Because I mean, we could do questions all day because we're going to do questions. But tell me, what through the chat, what do you guys, what issues do you have? For example, when it comes to a case like endocrinology, is it the values? Is it up and down arrow questions? Is it, what is it specifically? Because, the more we can address this, then we can then focus having everything else. That's the whole point, working together as a team so we can conquer as much as possible, so we have less things to worry about, right? Let's see in the chat. Anything, anybody in the chat here? My camera's moving around. Let's see. Chat away, chat away. Let's see. Well, arrow questions, and yes, thyroid concepts as well. Sure, of course, of course, of course. That's always been an issue for a lot of people. Thyroid concepts. Okay, so I did choose thyroid today because, I mean, again, seeing endocrinology twice in a month, there's a reason why I do what I do. So that I figured if we can conquer high thyroid, low thyroid, thyroid cancers, right? then you know about parathyroid, primary versus secondary versus whatnot, those kind of things. So if you want, Dr. Singh, put together a list for me of what specific concepts you're struggling with. And then Dr. Patel, as far as concepts, same thing with you. Today, we're going to do some questions. I want you guys to participate live. Who wants to jump on, raise their hands. You know, obviously, we're here as a team. At the same time, the arrow questions, just to show you something before we begin, right? So Dr. Singh, I'm going to bring you on, but give me 1 second. I'm going to share my screen one moment, and I'll do this. So this is my screen. This is actually, where's my step? I was doing step 2 because I do a lot of step 2 1-on-1 sessions. So step 2 is crazy. I had a question about Wagner syndrome. It's pretty interesting. When you have Amboss, and really, again, it is up to you what you decide. I just need, and I feel comfortable doing this so I can sleep better knowing that all my doctors I prep are very, very well informed of what they need to do. The arrows are always a big issue when it comes to exam prep. So Amboss does a great job. You can come here to study plans on the left side here. And in the study plan section, you have all these different tabs. You have to go to high yield exam prep. When you go here, they have all the high yield exam prep for you. Being that when you actually actively hit one of these windows, it shoots to the current section. So in the current section, you can see high yield table, high yield risk, patient chart, and so on. High yield table-based questions. You click on this. This is something that they included not too recently, but recently. This is all step 1 material. Can also pop up on step 2 and shelf exams for those of you studying for shelves. And you click one by one. And when you go to these questions, it's painful, but you got to do it. You go to these table-based questions, and top to bottom, there's 28 questions, one after the other, of what? Of tables. And the more you do this, the more you will feel comfortable. If you don't do it this way, what happens is on exam day, you'll get a couple, maybe on your NBME, maybe on your free 120 or assessment test, and you won't do as well because you get nervous. I used to get nervous too. I didn't have these resources when I took my test a long, long time ago, to a point where how awesome is this? You've seen me do table questions before. So if you have Amboss, you can take all these 28 questions. I'll put this this link in the table in the training hub. So if you guys have an active Amboss account, then all you got to do is go to the training hub and click it, and you'll get it. I'll just share the link with you. If you prefer otherwise, you can just go to study plan. It's here. Everything is here in the high yield exam prep. Please take advantage of this. I advise you, because what it comes down to is if you don't do it this way, then you're just going to wait until you get it in a random set of questions and still not feel comfortable. So if you do it this way, I can promise you'll feel a lot better. So when you get questions on your exam, this up or down or increase, decrease, these are infamous, right? So take your time. If it's difficult for you, make sure why it's difficult. It could be maybe the concept versus not really sure which levels are up or down. Just reading in first aid isn't enough, because you'll see arrows go up and down in first aid, in your books and textbooks, videos, presentations, and then days, weeks go by, you get a question and they ask you a question. And when you get the question, you know what it is. So try to do that. Again, I'll put the link in the training hub after. At the same time, study plan here is pretty amazing. They keep adding more and more information here for step 1, step 2, osteopathic medicine for people who are in osteopathy. Step 2, step 3, they have high yield vaccination and screening. Like legit, this is the best source right now. Your world is amazing. I would do Amboss first, make sure I find all my cracks, make sure I'm working really hard to solidify everything, and then jump over to your world and annihilate it before my exam. If you have time, ladies and gentlemen, a couple of months, that's the best scenario. Amboss, then your world, kill the test and move. The more you do work now, the easier transition you're going to have on step 2, I guarantee. All right. Hope that helped. We'll definitely do more. Tomorrow's Tuesday, so we'll do a little acid-based disturbances in the morning, and then maybe we'll pull a couple tabled questions from Endo, and we'll do them tomorrow morning if you guys like. How does that sound? Sounds good? Cool. But I definitely want you guys to send me an email, send me a message, text me something. We'll keep concepts. Dr. Singh from the West Coast, are you ready to participate and knock some questions out of the park? Of course she is. That's why she raised her hand.
Hello.
How you doing? How you feeling?
Doing okay.
Good. Question. When is your time? When are you taking your exam? Anytime soon?
No, I was just actually talking about that with my fellow,
Hmm.
and like I'm trying to see if I could get a little bit more time, but
Okay.
um I feel
So,
like they might not give me that opportunity, so I would have to take it by the end of August.
okay. So let me know. Because, and again, we'll talk individually as well. This is important because if we don't have a certain goal, like a certain finish line, timeline, estimated date, we don't know we don't know how we're going to pace ourselves. So let me know if we are going to push for the end of August, because what if, let's say, they don't give you an extension, then you don't want to be stuck with no time, right? So
Right.
let's meet up this week, right? You and I, and again, we're going to meet up. I meet up all my doctors individually, especially when it gets down to the test coming up sooner than later. Because again, I know this is live, it's working together side by side, but I also like that one. I want to make sure, hey, what is it, some specific that we have to deal with to fix, right? Clearly, you
Yeah.
guys can bring your topics here, but I also respect the privacy, and especially one-on-one is also a little more intimate because we can tailor specific issues to specific people, right? So
Mhm.
let me know, all right, and then we'll do it together, right, Dr. Singh?
Okay, sounds good.
All
Thank
right.
you.
It's my pleasure. So you want to do some questions with me?
Yeah.
I'm going to start you off light. We'll do some farm questions. And then after farm, we're going to throw with some thyroid. And, again, if you guys, because we had a question like this earlier today with Dr. Fizza. If you've done questions before, clearly, if you're with me, you've seen a lot already, which means that if you know the answer, clearly you know the answer, right? That's not impressive. The impressive thing is, do you know the other answer choices? So if I was you and I see a lot of repetitive questions, especially in my Q bank, what I would then do is, okay, I got the answer. I saw the patient already, big deal. Make sure you don't make a mistake and you know the other ones. That's the main issue when it comes to the majority of these questions. Okay. So I want you to do some questions with me. We'll throw you off. We'll start you off easy, and then we'll throw some curveballs. That's what I do, especially Monday afternoon. Because you are early. You have 2 hours difference. You're on the West Coast, dog. It's two
Yeah.
o'clock there still. You have the whole day ahead of you. So let's do a few. If you guys know the answer, you can put it in the chat. Keep it to yourself. It's up to you. If you're doing these questions like Dr. Singh, don't look at the chat, right? Unless you really need help, because
Mhm.
the answers will be thrown in front of you. Doctor, take it away. Let's do it. Let's click and move. Let's do it.
Okay, so the physician prescribes an additional anti-diabetic drug and cancels the patient on its delayed onset of action. At a follow-up appointment 4 weeks ago, the patient reports that his home blood glucose readings have improved. He also mentions that he has had a weight gain of 8.8 pounds. The patient has most likely been treated with which of the following?
So, you want to go to the top, or you have an answer? You have an idea?
So with the weight gain, I know that
Mhm.
has to do with like sulfonylureas.
Okay.
So I'm leaning towards glyburide.
Okay. So, how about this? Glyburide is an answer. Sure. At the same time, what else do you see in the last four lines that you just read?
The patient has most likely been treated with which of the following? Blood glucose readings have improved, weight gain.
So we have, so if you go, let's go to the top to just dissect, right? We
Okay.
have 54-year-old man comes in for routine. Okay. He was diagnosed with type 2 a year ago. Okay. His medication is metformin. Clearly, you put people on metformin first, right? Okay. So far,
Mm-hmm.
so good. Glucose is high, and HbA1c is over 6.8, 6.9. It's bad. Right? It's not the worst, but it's not good. So you, the physician, decide to give Mr. Smith another medication. Okay. We don't tell you what the medication is. We just say, hey, Dr. Singh gave him another drug. This drug, you had to counsel Mr. Smith and tell him, hey, Mr. Smith, this drug will take time to work.